Where can I find modified exercises for stroke prevention? Finding modified exercises for stroke prevention is crucial for improving health and reducing risks. There are several reliable resources available that cater specifically to individuals at risk of stroke or those recovering from one. These exercises focus on enhancing cardiovascular health, mobility, balance, and strength while minimizing potential risks. First, consider starting with healthcare providers and rehabilitation specialists. It is essential to consult professionals such as physical therapists, cardiologists, or neurologists. They can perform safety screenings and create personalized exercise plans based on your specific health needs and capabilities. These experts will monitor your heart rate and exertion levels to ensure that you exercise safely. Another excellent resource is stroke associations and foundations. Organizations like the American Stroke Association provide valuable materials that include guidance on safe exercise types, safety considerations, and post-stroke recovery exercises. Their resources often feature videos and step-by-step instructions for modified exercises that are suitable for stroke survivors or individuals at risk. You can also explore scientific and medical literature on stroke prevention exercises. Research reviews and guidelines from reputable bodies like the American Heart Association and the American Stroke Association recommend a combination of aerobic and strength training exercises. For instance, moderate-intensity aerobic activities, such as brisk walking or stationary cycling, should be done 3 to 4 times a week for about 40 minutes. Strength training should occur 2 to 3 times a week, focusing on large muscle groups. These guidelines emphasize the importance of gradually increasing exercise intensity and incorporating behavioral support programs to help transition from a sedentary lifestyle. Structured behavioral and physical activity programs are another effective option. These comprehensive programs often include behavior change techniques that can significantly increase physical activity levels after a stroke or in stroke prevention. They typically incorporate modified exercises to accommodate fatigue, balance issues, and other complications that may arise. Lastly, many medical centers and stroke organizations offer online resources that feature videos demonstrating safe, modified exercises. These platforms emphasize starting small and gradually increasing intensity. They also encourage incorporating activities that reduce sedentary behavior, such as standing more often, walking short distances, and using stairs. When seeking modified exercises for stroke prevention, keep in mind a few important considerations. Always consult with a healthcare professional before starting any exercise program, especially if you have cardiovascular risk factors or a history of stroke. It is crucial to monitor exercise intensity, aiming for moderate levels that raise your heart rate without triggering any adverse symptoms. Incorporate a mix of aerobic activity, strength training, and non-exercise physical activity to reduce sedentary time. Safety screening and personalized adjustments are vital to address balance issues, fatigue, and any other health conditions you may have. In summary, accessing modified exercises for stroke prevention is best done through professional guidance, stroke-focused organizations, and evidence-based programs that prioritize safety and gradual progression. These resources ensure that exercises are tailored to individual needs and align with current medical recommendations on stroke prevention.